Hi there. I hope you guys are doing very well and hope you guys are taking really good care of yourself. So, thank you for taking your time and come for your pharmacology classes. So, today I'm going to deal with anti-cancer drugs. Now, I'll just take during this class, I'm just going to take only few things. Okay, I'll just tell you what is anti-cancer drugs, what is the main classification of it, and we will just see just a small important toxicity that you can find in one of the classification. Okay, so this is a very important chapter which carries good details and good particular marks for it. More weightage will be given for it. So I'll just tell you what do you mean by anti-cancer drugs. So anti-cancer drugs, they're basically designed just for either killing the cancer cells, or they also take part, other than killing, to just modify their growth. So you know what is a cancer. You know the cancer means it is the abnormal cell division. So we can go for killing it, or you can just slow down the growth or the cell division which will be taking place. And if you see, compared to any other particular group of drugs, these anti-cancer drugs, they have or they carry a lot of complications with it. Because when the anti-cancer drugs are being administered to a patient, you must remember that it's also going to affect or even kill the normal cells. So because of that, there will be a lot of complications. And if we are not very careful on those things, it's really going to harm the patient. And especially when you are putting a patient on anti-cancer drugs, you have to ensure that you give a lot of psychological support, because they are going to get exhausted physically as well as emotionally. So your psychological support is very, very important here. Okay, so you need to understand, when do we go for giving anti-cancer drugs? When you need to go for curing cancer, you have to go for anti-cancer drugs. Or when you're suspecting certain remission, there are chances that in certain areas you can find a lot of remission takes place. Such kind of cases, you will have to start again. In case of palliation, we go for anti-cancer drugs, and also as an adjuvant chemotherapy. Almost all of you are very familiar with what you mean by chemotherapy. So in chemotherapy also we go for using anti-cancer drugs. Now I'm going to step into the important question which they always ask in the questions in the exam. It can come as a 10-mark question or even a 5-mark question. That is your classification. Okay, so you have a very long list of classification in it. So it takes a lot of practice by just going through the particular drugs, and you can just keep on recollecting it. Okay, so usually the drugs are being classified basically on as drugs that behave, or we call it as cytotoxic drugs. Okay, that means they are going to directly act on the cells, as well as we have the drugs that are going to change the hormonal milieu, or it's going to change the way the hormones are going to affect the body. All right, so first we will see what are the drugs which are classified as cytotoxic. So once again I repeat, the anti-cancer drugs, they are classified into two. We have cytotoxic cells drugs. Okay, cytotoxic drugs, these are the drugs that will be directly acting on the cells. And then we have the drugs that's going to act on the hormonal milieu. Okay, so I'm going to start with cytotoxic drugs. All right, so if I give you a brief introduction, what do we mean by cytotoxic drugs? Okay, so you can find that they have a very good impact on the multiplying cells. Okay, in fact, the impact is going to be very rapid. It's going to be very quick. It's going to be and it's going to be profound. Okay, so cytotoxic cells, or the drugs, the cytotoxic drugs, they're going to have a very good impact on the rapidly multiplying cells. Okay, and their main important thing, or the function, what they do is they will be targeting the nucleic acids and the precursors. Okay, you know that the nucleic acids, they form the DNA. So when these cancer cells are rapidly getting multiplied or undergoing a lot of changes, a lot of division inside, when we go for giving the cytotoxic drugs, what they mainly go for doing is either they go for just changing. We say sometimes we go for changing a particular number. In the same way, they go for changing the position of the nucleic acids. So as a result, what happens is the synthesis of nucleic acid will not be taking place, and as a result, they are going to rapidly affect the multiplication of the cells. Okay, so basically they are going to act upon the cell division, precursors, and the nucleic acid synthesis. So that's the main use of a cytotoxic drugs. Okay, so once again I'll say cytotoxic drugs, they are going to basically act directly on the cells. If you see, they are basically going to interfere with the multiplying cells, and it's going to produce a profound, rapid effect. And they will be basically involved in the nucleic acids as well as interfering with the precursors, which are a very, very important part of the cell division. Okay, so we're going to start with cytotoxic drugs. Now, we have a lot of classification in that. Okay, so first classification, it starts with alkylating agents. All right, the first classification what we have here is alkylating agent. So the drugs which come under alkylating agents are, we have mechlorethamine, which we otherwise call as a mustard hydrochloride. So the first drug that we have is mechlorethamine. The second one, what we will be finding over here is cyclophosphamide. Third, ifosfamide, chlorambucil, methylene. So these are the drugs you can find as the alkylating agents. And these alkylating agents, we have another name called as the nitrogen mustards. All right, so I repeat once again. So we will be having alkylating agents as the first classification, which is otherwise called as the nitrogen mustard. And here we have mechlorethamine, which we call it as a mustard hydrochloride. We have cyclophosphamide, and we have ifosfamide, and chlorambucil, and methylene. Now, the second classification that you can find under the cytotoxic drugs is ethylenamine. And only one drug we have under that, that is thiotepa. All right, so first one, remember, we have was the nitrogen mustards. All right, we're under the alkylating agent. Second group of classification we have is ethylenamine. Okay, and we have the drug thiotepa in that. And the third group of classification under the alkylating agent we have is alkyl sulfonate. alkyl sulfonate. And the drug that we have under alkyl sulfonate is busulfan. Busulfan. The next group of drugs that we have under this classification is nitrosurias. I repeat, it is nitrosurias. And we have carmazine. We'll be coming across lomustine. So these are the two drugs that we'll be coming across it. Carmazine and lomustine. And then we have is triazine, next group of drug under cytotoxic. Triazine. And we have dacarbazine drug in it. So these are your 5 divisions which we have under alkylating agents. So one we had was nitrogen mustard. Second we had was ethylenamine. Then we had was alkyl sulfonate. Fourth we had was nitrosurias. And the fifth one what we had is triazine. Now